Well, hello there, future nurses. Welcome back to another episode of Med Monday. So glad you're here today. So let's jump in and get started. So our medication this week is Carvedilol. The trade name is Coreg. Its functional class, it's an antihypertensive, and the chemical class is alpha-1, beta-1 adrenergic blocker. And this medication is given PO. It binds to the beta-adrenergic receptors, preventing response to the sympathetic nervous system, resulting in decreased heart rate. And the alpha-1 receptors cause vasodilation of the blood vessels, leading to decreased vascular resistance. Now, why do we give this medication? Well, it's given for hypertension, CHF, cardiomyopathy, and atrial fibrillation, atrial flutter. Reasons we do not give this medication or contraindications include hypersensitivity, asthma. However, a lot of patients that do have asthma are given Carvedilol instead of metoprolol because metoprolol does tend to affect that respiratory center a little bit more. So you will find in the clinical setting that patients with asthma are given Carvedilol. Decompensated heart failure, second and third degree blocks. And remember, if our patient has a first degree block and we give them a beta blocker, it can send them into a second degree block. If they have second degree block, type 1 or type 2, and we give a beta blocker, it can send them into third degree. And if they have a third degree block and we give them this beta blocker, they can go into sinus arrest. So we want to avoid giving it for that. Bradycardia, cardiogenic shock, pulmonary edema, sick sinus syndrome, and hepatic disease. Side effects include dizziness, fatigue, weakness, and those are all related to the lowering of the blood pressure. So if your patient has been walking around with an elevated blood pressure, say in the 150s systolic, and we give them Carvedilol and it lowers them to the 130s, well, the decreased tissue perfusion to the brain is going to lead to dizziness, fatigue, and weakness until they adjust to the lower blood pressure. It can also cause postural hypotension, so we want to let our patients know to change position slowly. Impotence in men, and again, that's with the lowering of the blood pressure, and bradycardia. Adverse reactions include severe bradycardia. And so a patient could be bradycardic and asymptomatic. When we talk about adverse reactions, specifically severe bradycardia, we are talking about patients who are symptomatic. So they're bradycardic, they're hypotensive, they're altered mental status, and so then that would be an adverse reaction. AV blocks, CHF, pulmonary edema, Stevens-Johnson syndrome, thrombocytopenia, anaphylaxis, angioedema, remember that's the swelling of the face, bronchospasm, so we're going to have a reactive airway. And our nursing considerations include black box warning. We want to not abruptly discontinue this medication because it can lead to dysrhythmias. A lot of times patients, regardless of the medication that they're taking, will feel better and therefore think, well, I feel better now. I don't need to take this medication anymore, and stop taking the medication abruptly. And that can lead with any medication to adverse effects. So in this case, it would lead to dysrhythmias. We also want to monitor our patient's heart rate, rhythm, and blood pressure. We want to monitor our blood sugar in diabetics because it can mask hypoglycemia. We want to monitor for peripheral edema. We want to monitor our patients for orthostatic hypotension, and you do not need an order to check for orthostatic hypotension. And when I'm initiating new beta blocker therapy in my cardiac patients, I always assess for this. We want to monitor therapeutic response. So is it actually working? Is it lowering their blood pressure? We want to weigh our patients daily, and we want to monitor our I&Os very strictly. So what are we going to teach our patient? Well, we want to teach them that they need to weigh themselves every day. I always tell my patients that they should weigh themselves first thing in the morning in their birthday suit is best. We want them to report a 2-pound weight gain in a day or 5-pound weight gain in a week, because this can mean that they're having some heart failure. We want them to take their blood pressure and pulse before taking their medication. And we want our diabetics to monitor their blood sugar very closely. We want to teach them to slowly rise to minimize the orthostatic hypotension, and they won't need to do this forever, but it's just initially while they're adjusting to the medication. We want, again, to tell them to not abruptly stop taking this medication. We want them to consult, as always, the pharmacist or their physician before taking any over-the-counter or herbal supplements. There are some over-the-counter cold medications that can raise blood pressure. Aleve pain is a pain reliever, and that can raise blood pressure. So we want them to check with their pharmacist or physician. And we want them to report pregnancy and avoid breastfeeding. So our challenge question this week is: the pharmacy sends Carvedilol 25 milligram tablets. However, the order is for 6.25 milligrams POBID. How much of the tablet will you administer? Now go ahead and leave your answer in the comments, and next week we will announce the winner of the challenge question. So I hope you guys have a great week, and until next time, keep working on your dream.